So today we'll be talking to Miss Melissa Edmond, who is a field clinician for St. Luke's Hospice. Okay, so first of all, I was wondering, what do you do and what is your background?
I am a bereavement coordinator for St. Luke's Hospice. We're affiliated with St. Luke's Hospital, and my role is to care for people that have serious illness. And I work in the field, so that means I get to go to people's homes and sort of invade their space and meet their families, hopefully. And I talk with my patients about all kinds of stuff. We talk about life, we talk about kids, we talk about their illness when we can, we talk about their journey. I try to get them to talk about their feelings. After the death of a patient, I continue to work with their families for 13 months.
Okay.
In a variety of ways. My background is pastoral care. Mainly, I was on staff for 14 years at a large Methodist church and dealt with people at all stages of their life, whether it be an illness, a divorce, a wayward child. So I guess my passion is sort of people and helping people on their journey.
That's awesome. So what do you think is in it for, what is the good part for the families, do you think? What helps them the most?
In terms of my role when I walk in?
Yeah.
I see my role as someone who, as a part of the hospice team, a patient has terrific doctors, nurses, social workers, people that take care of their needs. I see my role as to hopefully help take care of their hearts, their feelings. I think that's the most important thing. And also, I think personally, my job is sometimes to ask the hard questions of the patient. I think that sometimes when patients are sick, family members are afraid to ask questions. And I can come in as an outsider and hopefully get to know that person and care about that person. And sometimes have that dialogue privately that may be hard for a family.
Okay. And so do you think that for grieving families or people that are grieving, do you think that can be applied to, the coping mechanisms? Do you think that can be applied to, for example, if someone lost the ability to do something or they lost function in a body part? Do you think that they can grieve properly by using other coping mechanisms?
Absolutely. There's a kind of grief, and I think this is what you're talking about, Megan. There's a particular type of grief called disenfranchised grief. And that's basically a grief that's not recognized by the rest of the world. We all know that people grieve when someone they love dies. However, when people lose a body part, when people lose a pet, when people lose a child through alcoholism, it's kind of a loss that the world doesn't usually recognize.
Right.
So I have used in the past kind of similar mechanisms in helping that type of grief in terms of, the normal time that the world sees with regards to death.
Okay. So then overall, what do you think is the main piece of advice that you would give for anyone grieving for just about anything?
Boy.
I know that's kind of a broad question.
I think that grief lasts forever. I never tell someone, oh, wait 6 months, you're going to get over it.
Right.
I don't think you get over a great loss, but you do learn how to live with it, and the world will forever be different, and maybe that's okay. It's a part of the journey, and I think that the deep, dark pain will not last forever.
Right.
We go on.
Okay. Thank you so much.
You're welcome, Megan.
Thank you to Melissa for joining us today and teaching us about disenfranchised grief and all of the different ways that we can be affected by that, and just in general for being a wonderful resource for hospice patients in the Kansas City area and their families.